I am Sudha Sundar. I am Professor of Gynae Cancer at Birmingham, and I'm a consultant in gynae cancer surgery at Birmingham. I'm delighted to be the surgical lead of the National Ovarian Cancer Audit. This is a cause I feel passionately about, and I genuinely believe that this will drive care for patients with ovarian cancer forwards in the UK. But actually, I think it will be a real standard setter internationally for women with ovarian cancer. So I'm really pleased to be associated with this. So the ovarian cancer audit will use routinely nationally collected data. So this is something we're actually really fortunate to have. And we will look at data collected through cancer registry purposes. So every patient with cancer, unless they've opted out, will have a basic set of data collected from them and sent to cancer registry purposes. And this allows us to get granular information on their diagnosis, on the treatment that they've received, on surgery, on chemotherapy, and of course, eventually their cancer alive or succumbed to cancer status. So this then allows us, along with granular detail on chemotherapy and surgery from the hospital episode statistics dataset, for us to be able to analyze what the outcomes are, look to see how these outcomes vary across England and Wales, against a set of national metrics, and we'll aim to put the first set of data in public domain in September 2024. Our aspiration is that we're able to put data in sufficient detail so that patients and their carers and clinicians will be able to see for themselves easily where their local cancer center is vis-a-vis these data, and that this will drive cancer care forwards. I mean, I have to correct you slightly there in that we've had a society-funded, charity-funded, co-funded feasibility pilot audit now for a few years, since 2018, in fact. And this is because we as a clinical community and our patient groups and charities felt that care for ovarian cancers varied a lot across the country. And we felt that this is something that we had to look at more carefully. So in fact, we co-funded that initial audit. It's called the feasibility pilot audit. And if you Google it, you can find the outputs from it. And that basically showed that only half of the women with stage 2 to stage 4 ovarian cancer in England will receive standard of care treatment. About a quarter of patients will not receive any anti-cancer treatment at all. So we know that these variations exist. And in fact, there's quite a substantial variation in survival, overall survival in ovarian cancer. And so the new audit now is the NHS-funded audit. It's the longer-term audit that we campaigned for. And I'm so grateful that we're now at this point where we've been able to use this our data, our pilot data, that we can segue onwards to a national audit that's long-term, and hopefully we will also end in the same place where the other cancers like colorectal or prostate have been for years. So understanding how surgery is different across the different hospital cancer centers in the UK, in England and Wales, I think will be phenomenally useful. And we now have the fully funded audit to address that. I think understanding chemotherapy better, how chemotherapy varies across England and Wales, understanding how the new molecular tests that we're doing, what their uptake is, and the genetics of patients with ovarian cancer. We know that this data exists, but it's not kind of linked in with the cancer outcomes data yet. So these three places, I think, will be really helpful for us to focus on. And of course, we already have metrics for ovarian cancer that we've agreed within the community. It'd be really nice to see how people are performing, for use of a better word, vis-a-vis these metrics, because we know we can. Since the publication of our previous pilot audit results, there have been a number of structural changes in England, rehabilitation clinics. We know certainly in the West Midlands, which is where I practice, there's been an NHS-funded operational delivery network that aims to improve care locally because of the data from the pilot feasibility audit. So the data that we already have has led to quality improvement. And I really hope we can entrench this and expand this through the new National Ovarian Cancer Audit data. Yeah, I think I think that would be amazing, because our previous data sets have looked back a few years. I think the possibility of looking at not perfect data, but methodologically perfectly good enough data over a shorter time frame, over say a 2-year time frame, will I think and it's contemporary data, because I think COVID data is hard to really understand or unpick in the non-COVID era. So post-COVID, looking at those years in a rapid turnaround, I think will give us a very good feel for where we are now and where we can be in 5 years' time. And it also gives us a benchmark so we can rapidly look to see how care is improving.